Hello, doctors. Welcome to another new episode of Eco Stories. I am Dr. Mohammad Shafiqul Islam. I will present a new video, a new case, which is on stuck prosthetic mitral valve. So, let's begin. A 46-year-old male presented with severe shortness of breath, and he has a history of mitral valve replacement 1 year ago. So as we can see, there is bat wing appearance in the chest x-ray, and there is a mitral valve prosthesis in situ. So we assume this is a case of prosthetic mitral valve thrombosis. On bedside echocardiogram, we can see the mitral valve gradient is increased. It is around 14 millimeter mean. So we plan to give injectable streptokinase, but there was an interesting twist. Similar 2 weeks ago, he has a similar episode of a valve, stuck valve, and at that time he was treated with injectable streptokinase. And 3 months before that episode, another episode of stuck valve, and he was also treated with lytics at that time. So there are recurrent episodes of prosthetic heart valve thrombosis in the last 3 months. So we counseled the patient for tenecteplase. So after giving injectable tenecteplase, patient's shortness of breath was reduced. But we have to think, why this recurrent episode of thrombosis? First of all, we searched for, was it anticoagulation failure? But his INR was therapeutic. So we have to search for any hypercoagulable pathology. But patient has some economic constraint he could not afford. At that time, a simple investigation, that is the CBC, we looked very carefully. And here we can see the eosinophil count was very high. And at that point, the hidden clue clicked in our mind that it can be a case of eosinophilic thrombosis. So we treated with injectable steroid, methylprednisolone, and also give him some antihelminthic. Though we have to search for autoimmune cause or any neoplastic cause, but due to some economic constraint, we could not afford that. But we follow up the patient with some short course steroid, and he was all right. Thanks for watching. If a patient comes with recurrent episode of thrombosis in the prosthetic valve, always check the eosinophil. It's a simple clue, but it can solve complicated cases.